Did you know that intestinal worms are a global problem that affects more than 1 billion people each year? These parasites, often invisible to the naked eye, can wreak havoc on your body, triggering uncomfortable symptoms and, in extreme cases, compromising your health in ways you might not realize. Understanding the impact of these parasites and the risks associated with them is crucial to protecting your well-being. Let's explore how these worms could be undermining your health and why it's essential to know about them to ensure a healthy life free from parasitic problems. Roundworms, known scientifically as Ascaris lumbricoides, are intestinal parasites that have the potential to cause serious health problems. Imagine a worm that can grow up to 35 centimeters long inside your intestine, living inside you without you even realizing it. These worms are long and thin, pink in color, and their presence is more common than you might think. A roundworm infection occurs when tiny eggs, which are virtually invisible to the naked eye, enter your body. These eggs are often found in contaminated food or water and can also be found in soil where you come into contact, especially if proper hygiene measures are not followed. Once the eggs are ingested, they develop into larvae in the intestinal tract. In a surprisingly complex life cycle, the larvae do not just remain in the intestine. They will migrate to the lungs via the bloodstream, which can cause symptoms such as coughing, difficulty breathing, and chest discomfort. It is a distressing experience, and many may feel confused by these symptoms without any apparent cause. After migrating through the lungs, the larvae return to the intestine, where they mature into adult worms, which can cause further symptoms such as severe abdominal pain, persistent nausea, and even vomiting. The discomfort and pain caused by these roundworms is real and can significantly affect quality of life. You may start to notice symptoms such as abdominal pain, which can range from mild to severe, depending on the worm burden. In addition, a feeling of constant nausea and a persistent cough are signs that should not be ignored. The impact of roundworms goes beyond physical discomfort. They can also lead to nutritional deficiencies, as they compete for the nutrients your body needs to function properly. This can result in weight loss, weakness, and anemia. Diagnosing the presence of roundworms is relatively simple and involves stool tests, which identify the eggs or, in some cases, even the worms themselves. There is no need to panic, as early detection is crucial and treatment is quite effective. Treatment usually involves antiparasitic medications that eliminate the worms from your body, providing relief from symptoms and preventing more serious complications. It is important to seek medical attention as soon as you notice symptoms or if you have reason to suspect an infection. The thought of having invisible worms living inside you can be scary, but the good news is that roundworm infections are treatable and, with the right approach, recovery is entirely possible. Maintaining good hygiene, washing fruits and vegetables thoroughly, and ensuring that your water is safe to drink are all essential preventative measures to avoid this type of infection. Remember, knowing the symptoms and being aware of your health can make a big difference in ensuring that you stay healthy and free from these pesky parasites. Gut health is essential to your overall well-being, and being informed is the first step to protecting it. Tapeworms, also known as tapeworms, are intestinal parasites that can cause significant health problems. Some of the most common are Taenia saginata, which is the beef tapeworm, and Taenia solium, the pork tapeworm. These worms can grow to impressive lengths inside the human intestine and are more common than you might think, especially in regions where the consumption of raw or undercooked meat is common. Tapeworm infection begins when you eat meat contaminated with tapeworm cysts, which can be found in undercooked beef or pork. These cysts, also called cysticerci, can develop into adult worms in the intestine, where they attach themselves and begin to grow. The tapeworm life cycle is quite complex and involves several stages, including the migration and development of the cysts in different parts of the body before settling in the intestine. Once in your intestines, the worms can grow to several feet long, and while they're there, they feed on nutrients that should be available to your body. This process can cause a range of uncomfortable symptoms. Many people with a tapeworm infection don't have any visible symptoms at first, which can lead to the problem going unnoticed. However, as the parasite grows, symptoms begin to appear. Common signs include abdominal pain, which can range from mild to severe, unexplained weight loss, and anemia. Weight loss occurs because the tapeworm consumes a significant portion of the nutrients in the food you eat, and anemia can develop due to blood loss or nutrient deficiencies. Diagnosing a tapeworm infection usually involves stool tests to identify the eggs or segments of the worm. In some cases, imaging tests such as ultrasounds may be needed to detect cysts that may have formed in other organs of the body. If the infection is confirmed, treatment is quite effective and usually involves the use of antiparasitic medications. These medications are designed to eliminate adult worms from the intestines and destroy any cysts that may have formed. Treatment not only relieves symptoms but also prevents more serious complications, such as intestinal blockages and secondary infections. Prevention is key to avoiding tapeworm infection. Ensuring that meat is thoroughly cooked is the most important precaution. In addition, practicing good hygiene, such as washing your hands and kitchen utensils thoroughly, can help reduce the risk of infection. Knowing about these tapeworms and how they affect the body can help you recognize early signs and seek appropriate treatment in time. Remembering that early detection and treatment are essential for a full recovery can make all the difference in your health and well-being. Education and prevention are your best defenses against these parasites that can affect your life in unexpected and unwanted ways. Pinworms, known scientifically as Enterobius vermicularis, are small intestinal parasites that are quite common, especially among children. These worms, which measure about 1 to 2 centimeters in length, have an intriguing life cycle and can cause considerable discomfort. Pinworms are known for their thin, elongated, hair-like shape, and their reproduction is somewhat peculiar. Adult females move up to the rectum and exit the anus at night to lay their eggs in the surrounding area, which causes intense itching and discomfort. Pinworms are transmitted primarily through the ingestion of eggs that are present on contaminated surfaces, such as towels, bedding, and toys. These eggs are tiny and can be easily spread through direct or indirect contact with infected items. For example, if a child scratches the affected area and then touches objects or food, they can spread the eggs to other surfaces, perpetuating the cycle of infection. This form of transmission is particularly challenging in settings such as schools and daycare centers, where contact between children is frequent and hygiene may be inadequate. The symptoms of a pinworm infection are notably uncomfortable. Anal itching is the most common symptom and can be so severe that it interferes with sleep in children and sometimes even in affected adults. This discomfort is caused by the eggs deposited around the anus and can lead to skin irritation. In addition to itching, the infection can cause sleep disturbances due to the constant feeling of discomfort, and in some cases, irritability and loss of concentration. The discomfort can be so severe that it affects the quality of life and general well-being of the affected person. Diagnosing a pinworm infection is relatively simple and involves using a test called the stick tape test. This test is done by placing a piece of sticky tape around the anal area to collect any eggs that may be present. The sample is then examined under a microscope to confirm the presence of eggs. This method is effective because the eggs can be present in very small quantities and are difficult to detect without proper collection. In addition to the stick tape test, stool tests can also be used to identify the eggs. Treatment for pinworm infections usually includes antiparasitic medications, which are very effective in killing the worms and relieving symptoms. The most common medications are mebendazole, albendazole, and pyrantel. It is important that all family members are treated at the same time to prevent reinfection, as the eggs can easily spread and cause new cycles of infection. In addition to medication treatment, it is essential to maintain good hygiene to prevent reinfection. Washing hands thoroughly, keeping fingernails short and clean, and changing bed linens and towels regularly are all important steps to reduce the risk of spreading pinworms. Although pinworm infections can be uncomfortable and cause significant disruption, early detection and appropriate treatment can resolve the problem quickly. With the right combination of care and preventive measures, it is possible to effectively manage the infection and restore comfort and general health. Hookworms, known as Ancylostoma duodenale and Necator americanus, are intestinal parasites that can cause significant health problems. These worms, which belong to the nematode family, are small, but their presence can have a large and negative impact on overall well-being. Hookworm infection is a global health problem, especially in tropical and subtropical regions where sanitation is inadequate. Hookworms have a complex life cycle that begins in the soil. The worm eggs are excreted in the feces of an infected host, and when this feces contaminates the soil, the eggs develop into larvae. These larvae can live in the soil and are able to penetrate human skin when a person comes into contact with contaminated soil. This contact usually occurs when walking barefoot in infected areas, which allows the larvae to penetrate the skin and enter the bloodstream. Once in the bloodstream, the larvae are transported by the lungs, and from there they move to the gastrointestinal tract. In the intestine, the larvae develop into adult worms, where they attach themselves to the intestinal mucosa and begin to feed on the host's blood. Hookworm infection can cause a range of symptoms, ranging from mild to severe, depending on the parasite load and the general health of the host. One of the most common effects of infection is anemia. Hookworms feed on the host's blood, and this continued blood loss can lead to a significant decrease in red blood cells, resulting in anemia. Symptoms of anemia include fatigue, weakness, paleness, and in severe cases, difficulty breathing. Anemia caused by hookworms can be debilitating and affect the ability to perform normal daily activities. In addition to anemia, hookworms can cause abdominal pain. The presence of adult worms in the intestinal mucosa can lead to inflammation and irritation, resulting in abdominal discomfort, cramping, and bloating. Abdominal pain can be persistent and uncomfortable, and in some cases, may be accompanied by diarrhea or other gastrointestinal problems. Another symptom that may occur, especially during the early stages of infection, is coughing and other respiratory problems. This is because the larvae migrate through the lungs before reaching the intestine. During this migration, they can cause irritation of the respiratory tract, leading to coughing and difficulty breathing. This symptom is usually more prominent in the early stages of infection, when the larvae are moving through the lungs. Diagnosing a hookworm infection usually involves analyzing stool samples for the presence of eggs. This test is effective in identifying infection, as the eggs can be seen under a microscope. In some cases, blood tests may be performed to check for anemia and other complications associated with the infection. In addition, stool tests may reveal worm eggs, confirming the presence of hookworms in the intestinal tract. Treatment for hookworm infection involves the use of antiparasitic medications that are effective in eliminating the worms from the intestine. Medications such as albendazole, mebendazole, and levamisole are often used to treat the infection. These medications help to kill the adult worms and reduce the parasite load, relieving symptoms and preventing further complications. In addition to drug treatment, it is crucial to take preventive measures to avoid reinfection. Maintaining good hygiene practices, such as washing hands and feet thoroughly and wearing appropriate footwear when walking in potentially contaminated areas, are important measures to reduce the risk of infection. Improving sanitation and ensuring that soil and water are free from contamination are also essential to controlling the spread of hookworms and protecting public health. Hookworm infections can have a significant impact on your health, but with early diagnosis and proper treatment, you can effectively control and treat the infection. Staying informed about the risks and prevention practices is key to protecting your health and ensuring a life free of these parasites. Knowledge and proactive action are your best defenses against hookworms and other intestinal parasites. Maintaining intestinal health and preventing intestinal worm infections is essential to avoiding discomfort and serious complications. The good news is that with a few simple practices and daily care, you can significantly reduce your risk of parasitic infections and keep your intestinal tract in good condition. First and foremost, one of the best forms of prevention is to ensure good personal hygiene. Washing your hands frequently, especially before meals and after using the bathroom, is a key practice to avoid ingesting worm eggs that may be present on contaminated surfaces. Make sure children follow these practices as well, as they are particularly vulnerable to parasitic infections. Additionally, keeping fingernails short and clean helps prevent the collection of eggs that can be transmitted to the mouth through contact with the anal area. Another important measure is proper food preparation. Cooking meats thoroughly to the recommended internal temperature is crucial to kill any parasites and eggs that may be present. Undercooked meat is a common source of infection with tapeworms and other parasites. When preparing food, it is also important to thoroughly wash fruits and vegetables under running water, especially those that will be eaten raw. This helps to remove any dirt or contamination that may contain worm eggs. Cleaning and maintaining environments also play an important role in prevention. In areas prone to parasitic infections, such as gardens and outdoor areas, it is recommended to wear appropriate footwear to avoid direct contact with contaminated soil. At home, keep the area around the toilet and frequently touched surfaces clean and disinfected. It is also essential to ensure that the water consumed is treated and safe, especially in areas where the water supply may be contaminated. In addition to preventive measures, it is vital to understand the importance of timely diagnosis and treatment of intestinal worm infections. If you or someone you care about is experiencing symptoms such as persistent abdominal pain, unexplained weight loss, anal itching, or digestive problems, seeking medical attention is essential. Early diagnosis, usually done through stool tests or other tests, is crucial to identifying the presence of worms and starting appropriate treatment. Proper treatment can quickly relieve symptoms and prevent more serious complications. Antiparasitic medications are effective in eliminating worms and can restore intestinal health in a short time. In addition, following medical advice regarding treatment and prevention of reinfection is essential to ensuring a full and lasting recovery. Ignoring symptoms or delaying treatment can lead to more serious problems, such as severe anemia, intestinal blockages, and secondary infections. Maintaining intestinal health and preventing intestinal worm infections is essential to avoiding serious complications. Fortunately, with simple practices and daily care, you can significantly reduce your risk of parasitic infections and keep your intestinal tract in good condition. Personal hygiene measures, such as washing your hands and cooking food properly, are essential to preventing infections. In addition, early detection and proper treatment ensure a quick and effective recovery. By adopting these practices and seeking medical attention when necessary, you can protect your intestinal health and ensure a healthy and comfortable life. Remember, information and prevention are your best defenses against these pesky parasites.